The today's topic is Aamaja and Niramaja jwara. Basically, Aamaja and Niramaja jwara are not the types or a classification of a jwara. They are the state of a jwara. How the disease will manifest, like now is jwara is going to take place. So what is the symptoms of that onsetting of jwara, and the now peak hours of a jwara is this. So what are the symptoms included in that situation or in that state, and now the jwara is going to get relief. The patient is going to relieve from the jwara. So what is the stage and how it will be? These are the different state or avastha of a jwara that includes three types. Those are Aamavastha, Pachamanavasta and Niramavastha. So first one, Aamavastha. It is the stage of a fever. So now the dosha, the prakupita dosha are combining with the Aama. That is called Aamavastha. Adya ahara dhatu does not undergoing further activity. That's why it causing the srota avarodha. As I already mentioned in the previous video, it's causing the Aama. So that state is nothing but the Aamavastha. So what and all the symptoms and lakshanas the Aamavastha is going to show? Let us see. Aruchischa, avipakascha, gurutvam udarasyacha. So there will be a aruchi, that is loss of appetite will be there. Anorexia is going to occur. Avipaka, indigestion, because of the Aama is present inside the Amashaya. There will be a indigestion, and indigestion is going to take place. Gurutvam udarasyacha, because of the deposition of a Aama, there will be a heaviness in the Amaja, that is stomach or abdomen. Hridayasya avishuddhischa, there will be a chest congestion. Tandra, the drowsiness will be there. Alasya mevacha, there will be a laziness because of the Aama is present. In Aamavastha is present, Aama will it will be always obstructing the daily activities and the enthusiasm. When there will be a lack of enthusiasm, there will be a tandra and alasya in the person is going to show. Jwaro avisargi balavan dosha pramana pravartanam, that is jwara is going to takes place. Now the jwara, onset of a jwara is there, and there is a continuous high fever is going to present. Lala praseko, there will be excessive salivation will be there. Hrillasaha, that is nausea is going to take place. Vomiting sensation is produced in that patient. Kshunnasho virasammukam, there will be a lack or a complete absence of attractiveness towards the hunger, that is absence of a hunger will be there, that is kshunnasha. Virasammukam, there will be a lack of a taste, and kashayasyata will be there. Stabda supta gurutvam cha gatranam bahumutrata, there will be a stabda, that is obstruction or a stiffness. Supta, the numbness, and gurutva, heaviness in the gatra, in sharira, there will be a production of a stabdata, suptata and gurutva. And bahumutrata, excessive urination is going to take place in a patient. Na vit jirne na cha glanir jwarasya aamasya lakshanam, there will be a incomplete digestion. Na vit jirne and na vit jirne, so incomplete, when the person passes a stool, he will not feel satisfied or he will not feel complete. And jirna, there will be always indigestion will be there. Nacha glani, there will be a fatigue will be there. And jwarasya aamasya lakshana, these are the different kind of Aamavastha jwara lakshana. So the person is going to have a fever, he will be presenting this kind of disease, then you need to consider it as a Aamavastha of a jwara. How to treat this Aamavastha jwara? When the jwara is in Aamavastha, so further we need to give a pachaka dravyas, and Roganidana said that Aamaja jwara, they suddenly don't give a pachaka dravyas. Instead, you need to administer a patient to be on a fasting, that is langana you need to administer for the patient, because jwara do langana, the first line of treatment for a jwara is anywhere and everywhere. First you need to say for that patient is do a langana, do a fasting. Then the Aama in the body is going to decrease, and further you administer the pachaka dravya and deepana dravya. So Aama will be digested and the jataragni will be increased. When jataragni will be increased, then there is no need to do further treatment, when the Kostragni will be correct and everything in the body will going to be correct. So next is Pachamanavasta, stage of a peak fever. In the Pachamanavasta, there will be a high rise of a temperature and high degree fever is going to take place. So what are the symptoms that Pachamanavasta is going to produce? Those are jwaro, jwara vego adhika trushna pralapaha shvasanam bramaha, malapravrittir utkleshaha pachamanasya lakshanaha. So jwara vego adhika, the increased raised temperature of a jwara, the body is going to take place in a high degree fever like 104 degree, and trishna, like excessive thirst is going to produce in that patient. Because of the excessive temperature rise, there will be a decrease of a mahabhuta in the body, so it produces the excessive trishna pralapaha. The person is like very delirium, and he is not intolerant to everything. Like if somebody talk to him, he will be like, he shouted out and he burst out because of the excessive uh, temperature inside his body. Burning sensation will be there, that's why he is intolerant. Shwasanam brahmaha, the excess shwasanam, that is excessive difficult breathing he used to have, like the sound of a shwasa we can feel in that patient. Brahma, the patient may go into unconsciousness, giddiness he can feel. Because and usually we will observe in a patient when there will be a 104 degree Fahrenheit temperature is going to produce, the fever is going to produce, the patient will go in unconsciousness and he is not having the feel of the outside world because of that temperature rise. Mala pravrutti utklesha, that is excessive excretory reflex is going to take place, that diarrhea may happen or vomiting may start. Pachamanasya lakshanam, these are the different kind of lakshanas produced in a pachamanavasta. Pachamanavasta is a severe state of a disease, severe state of a fever. So suddenly we need to treat a patient by the samshamanavati or a tribhuvana kirtiras like sarva jwarantaka lauha and all. We need to treat the patient fastly with a quick acting drugs so that we can rescue a patient. If this pachamanavasta is gone untreated, or it took a time for us to diagnose the patient or to treat the patient may go under the coma or he may die also. And next is the niramavasta, stage of a relief from the fever. Now the aamavastha is over, may I treat in the aamavastha, then person is going to attain a niramavastha. The Aama in the patient body I have subsided, so he is turning to niramavastha. There nirama, the absence of a aamavastha. So stage of a relief from the fever. The jwara is produced mainly due to the aamavastha, right? That's why the aama is going to decrease, the niramavastha, the stage of relief from the fever. So to the niramavastha present symptoms like kshut kshamata lagutvam cha gatranam jwara mardhavam dosha pravrittir ashtaho niramajwara lakshanaha. So what are the niramajwara lakshanas? Kshut kshamata, that is there will be a loss of appetite and indigestion is going to take place in a body. Aruchi will be there. So when the patient is going to have a niramavastha, the suddenly gradually he is having the hunger in his body and he will be having a liking towards a food. He wants to eat a food, he will have that urge to eat. And lagutvam cha gatranam, there will be a lightness in the body. Because of the presence of a aama, there will be a heaviness is going to produce in a body, and there will be obstruction to any kind of a any kind of a movements or any kind of a bodily elements is going to take place. That will relieve when the patient in niramavastha. And jwara mardhavam, the body is going to attain a softness, the soft skin is going to produce. Dosha pravrittir rashtaho, the softness in the skin. The dosha is going to attain a pakhyavastha, and they will go to the place and they will subside, they become very calm and cool, and these are the lakshana of a niramavastha of a jwara. So these are the different kind of a avastha. So for when the patient comes to you, please always diagnose his state of a fever. Like if he is in a aamavastha, so you can take a chance and you can take a treatment for a 5 to 6 days. Like you need to administer langana for a first day, and when he suddenly having some relieving factors, then you can administer a virechana or excessive dose drugs. But when it comes to the pachamanavasta, you must and should attend the patient as soon as possible with a strong acting and fast acting drugs. Like when it comes to the samshamanavati, the vati prepared from the guduchi sattva, when you administer to the patient, the jwara is going to decrease in a 2 or 3 hours. and you need to give multivitamin tablets, and you need to, in a pachamanavasta, if patient comes, you need to have one saline, you need normal saline you need to administer for that patient because of the diarrhea and dysentery present in that state of a fever. When it comes to the niramavasta, always when you go for a hospital, before this, usually the doctor will say that okay, take these tablets and come and meet me after the 3 days or a 2 days or a 5 days. They will give you a one period to meet them again. So then you need when the patient come to you after the episode of a jwara, when he attends the niramavasta, when you come back, that is a niramavasta. So what should you do then? You need to administer a rasayanas or a avalehas like chavanprash avaleha, the immunity boosting agents. When it comes to the practice, you must and should treat the patient so that you will get a many more number of patients. So what should you do? In order to prevent the reoccurrence of that disease, the reoccurrence of the fever, you need to increase the immunity of that person. Now the environment or society is like very fast acting. If I relieve from the jwara, I have to do the next hour the work. Even comes to us also. So you need to improve his immunity further. Because of the lack of a immunity in his body, strength in his body, he may affect with the another disease when he exposed to the external environment or work pressure and all. When you administer any kind of a disease, any kind of a roga, you can take always except a kafaja vyadhi, that is tarpana is always santarpana is always inhibited in that. So when it comes to the any kind of a disorder except a kafaja vyadhi, you need to administer a patient one immunity booster like chavanprash avaleha. As I already told that samshamanavati you can take like gudichi kasha and you can administer to the patient, or dhatri swarasa, that is amalaki rasayana, amalaki swarasa you can administer, trifala churna you can administer. So increase the immunity so that reoccurrence you can prevent, and you will get a definite success in your treatment and good name as a doctor also. Thank you for watching the video.